Gestational diabetes is diabetes that develops during pregnancy in a person who did not have diabetes before they became pregnant. So, risk factors for developing gestational diabetes include being older than the age of 25, having a family history of diabetes, having a history of gestational diabetes in a prior pregnancy, being overweight, and if you're from a high-risk ethnic group, if you're of African American, Hispanic origin, or Asian origin, your risk is increased. Typically, patients who have gestational diabetes have no symptoms, so doctors screen for this. They may screen earlier in the pregnancy if you're considered very high risk, but routinely doctors will screen for gestational diabetes anywhere from 24 to 28 weeks. And that screening entails glucose tolerance testing, where you'll drink 50 grams of glucose and your blood sugar is measured an hour later. If your blood sugar exceeds 130, it's a positive screening test, and you'll be asked to do subsequent testing. You'll be asked to do a 3-hour glucose tolerance test. Here you'll drink 100 grams of glucose and your blood sugar will be measured hourly for 3 hours. And if your blood sugar exceeds normal on more than 2 occasions, that's consistent with a diagnosis of gestational diabetes.
If you're pregnant, your main concern is your baby. What are the implications for my baby? Is my baby going to be safe? The answer is yes, your baby is going to be safe, but there is gonna have to be a little bit of work.
Gestational diabetes is treated with a combination of approaches: changes in diet, increased physical activity, and medications if needed.
So a lot of women get overwhelmed when they're not only pregnant, but they've just been diagnosed with gestational diabetes. Because you have cravings to manage, you have all these extra nutrients that you have to get in, more omega-3s, more fiber, more calcium, all this stuff. So it's really great if you can work with a registered dietitian or a diabetes educator to help you plan out meals and plan out snacks. But the basic thing to keep in mind is that you want to get a mix of carbohydrate, protein, and healthy fats at each meal, and preferably at each snack as well, because that's going to really help manage your blood glucose.
After delivery, patients who have a history of gestational diabetes should do a formal glucose tolerance test within a couple of months of delivery. If that testing is normal, they should continue to be screened at least annually.
When you have gestational diabetes, that gives you a greater risk of developing type 2 diabetes down the road. So after the baby comes, keep up with your healthy eating and your exercise, and hopefully you can prevent diabetes down the road.